Hey there, everyone. Welcome back to another episode of the Growth Rune podcast, where we dive into all the facets of healthcare with experts who are leading the industry. Please join me in welcoming Jared Pelo, the co-founder at Bionic Health. Thank you so much, and we appreciate you for joining us, Jared. Organization.
Yeah, Sal, thanks for having me. I'm excited to talk to you, talk to your audience. So I'm an emergency medicine physician by training, and I felt like for so many years I was kind of like standing at the bottom of the cliff watching people fall off. They came to me, they had a heart attack, their diabetes was out of control. And so Bionic Health, what we do is precision kind of predictive medicine. We look at 30-year risk instead of 10-year risk for heart disease, stroke, diabetes, those types of things, and help people optimize their health. The kind of catchy term for it is longevity medicine. But I mean, really, it's just how do you make it so people are sick the least number of years of their life and they live as many healthy years as possible. And then my journey to get here has been through kind of entrepreneurship, healthcare IT, and AI over the last 10 years, trying to figure out like how to use AI in healthcare. So that's what we do at Bionic Health.
So what is your workflow like? How is it different from, say, the workflow of seeing your general doctor? How does Bionic Health do things differently?
Yeah, I mean, pretty much every way you could think possible. It is different. Um, you know, it might sound like I'm going to bag a little bit on primary care, and I don't mean to at all because the work they do is absolutely necessary and amazing. And I so appreciate people willing to work in that system. It is such an extremely difficult system to work in. But, you know, I, I think that 15 minutes a year with a physician isn't enough. And, maybe it is if you have a lot of other ancillary services around you, like if you have a nutritionist and trainer and like all these other services, then maybe 15 minutes with a doctor is okay. But what you really need out of somebody helping you decide how to be healthy is guidance, education, those types of things. So when somebody signs up with Bionic Health, they download our application. As soon as they do that, it starts stepping them through like step by step, what do you need to do? So first thing is you're going to set up an appointment to go get some blood work. We're going to do some advanced blood tests like lipoprotein little a and apolipoprotein B and other things that you probably never had tested before. But we know are going to shorten your life if you have those things and you don't find out. And then you're going to schedule some time with one of our advisors who are health coaches. And you're going to spend an hour telling them about your fitness, your diet, your sleep, your stress, your past medical history, your family medical history. You're going to do kind of all this intake. And then the doctor is going to take all that data, put it together, including like past lab data and things like that, and then present back to you what are your highest risk, what are you most at risk for in your life, and how do we mitigate those risks? What are the things we need to change? What are the lifestyle things we need to change? Are there any supplements, medications, etc.? And then it's a never-ending conversation, really, because you have us in your app. You can text with us, with your coach, kind of anytime. And really, the way I think about it is movie stars have their own personal doctor, and we're trying to make it so everybody can have like their own personal doctor and get great care and do it for a really affordable price. And that's where AI comes in to actually make it scalable so that we can afford to do it at scale.
So how critical is technology in your day-to-day processes? Like what processes, tools, or tech do you rely on to perform optimally?
Yeah, technology is built in from the beginning. So my background, like I said, I'm trained in the ER. But 10 years ago, started my first health tech company where we recorded doctor-patient conversations with the idea that someday AI would write notes. So average doctor spends 2 to 3 hours a day writing notes. And so the idea was what if you could capture the conversation and then use AI to write notes? We were, now AI scribes seem like they're popping up everywhere in medicine. We were one of the first ones. There was Augmetics and there was iScribes, and we were iScribes. And we built that for 3 years and sold that to Nuance Communications, makers of Dragon and PowerShare and all of that. And then Microsoft bought it, and that technology, Dragon Ambient Experience, is broadly used by thousands of doctors today, recording conversations and writing notes. What I learned, though, is that if you don't own the EHR, if you don't own all the data throughout the electronic health record, you can't really automate very much, because the EHR is going to dictate you can have access to this data and not this data. They even make it difficult for patients to get access to their own data. There are laws going into effect that are making this all a little bit better, but they're very slow. So we built our own electronic health record, which may sound absolutely bonkers, but we wanted to automate as much of the doctor's job for analysis, documentation, care of the patient, communication, all of those things. And then we built automation and technology in from the beginning. So, I don't ever receive a message or a lab or anything else that I don't have a piece of technology or a piece of an AI looking at and helping me with clinical decision support or communication or anything like that. So really trying to make it so that I'm the most efficient editor and not having to be the first author on anything that comes in, and then putting in all the safety guards that you need to make sure you don't send things out to people that is not like ready to go. The other thing is we're doing this in preventative care, longevity medicine, which it's not the intensive care unit or the emergency room. So we picked a location that is lower risk on purpose, and it's asynchronous, meaning I don't have to make these things come back within 30 seconds or 15 seconds. I can take my time to use the tools to automate things and make it more scalable. But there's not a piece of our process that AI or technology isn't touching.
So AI is something that's extremely new. A lot of people are getting their feet wet, just starting now. Well, I wouldn't say AI is relatively new. AI has been around for a long time. I would say LLMs, maybe GPT type technology that people have been leveraging, that's pretty new, and what's gotten people really excited about AI, along with some of the, the mid journey and all that stuff that people had a chance to play with. But healthcare is typically known to move a lot slower. And I'm not trying to bash on anybody here. I mean, I understand there's multiple parties in the room, and there are discussions that need to be made before anything gets adopted. But I want to focus on just the adoption side of things. Do you feel like there is a wall, or that's stopping people or reducing the velocity at which they would be adopting to the which they would be adopting these new technologies like AI, LLMs, GPTs? Do you feel like there's an adoption problem there at all?
I don't know about adoption problem, but you are correct. The medicine moves slow, and it's kind of by design. Like we've learned in the past, when medicine moves fast, there's some problems. There's kind of the old study in medicine. There was a medicine called Palladium that was used for nausea for pregnant women, and it caused their children to be born with like flippers. Like it shortened the limbs, and there were like real problems. But this was an approved medication that got out, and it was too fast, and we learned lessons. And so medicine moves slow on purpose, and it's because people's lives are at stake. So that being said, that just means you have to be smart about how you use the tools. I mean, AI, it's just a tool. It's like fire. You can use fire to cook your meat, cook your meal. It can burn your house down. And you got to be smart about how you use the tools, use them in contained ways, use them in smart ways. And so I think the other interesting thing you mentioned is AI has been around for a long time. And there's all these different types of AI, but this is the first time in human history when just a normal person, like a 12-year-old kid, can like play with an AI. Like up till now, the AI that they saw or that they knew was like giving them suggestions of what to buy on Amazon, but that was about it. Like it wasn't like smart. It didn't like do things that blew their mind or like expanded their brains. And so I understand why people are getting super excited around AI, and it's easy to like capture the imagination. Like you'll see anecdotes on the internet, like nobody could figure out my symptoms. Nobody could figure out what was wrong with me. And then ChatGPT figured out that I have, rheumatoid arthritis or something like that. And so it's easy to kind of capture the imagination that these AI are ready today to like take over the work of a doctor, which is absolutely crazy. It's just like we wouldn't let self-driving cars just take over all the roads. Even if you've used the most advanced, which, I have a Tesla. And so full self-driving was available to everyone a couple of months ago, and I tested it out, and I had to save myself multiple times a drive so that like the Tesla wouldn't murder me. And that's the most advanced. And it's ChatGPT and GPT-4 and 4.0, like Gemini, they're amazing models. They can do amazing things, but you can't like let them go willy-nilly and practice medicine and provide care.
Yeah, no, I completely agree with that. I think a great way to look at it is just as a tool, right? It could be a hammer or just like you said, fire. Super interesting. So I want to switch to digital literacy and the importance of digital literacy. And I'll explain what I mean by that. I mean, we're coming to a point where AI can't function correctly without data. And it's not just, oh, you have data, you're going to feed it data and you're done. It's like, okay, the data needs to be clean, the data needs to be marked. There's kind of like a touch involved, right? Between you as a person, your data in the middle, and AI. You're the AI model at the other end. How important do you think digital literacy for healthcare workers is going to be in the future? And I'm not just talking physicians here.
Yeah.
I'm talking physicians, admins, maybe probably not the patients. Maybe, I mean, if you have any ideas there. But how important do you think digital literacy is going to be? Is that something that we can avoid, or is that something that we need to prepare for?
Yeah, I mean, digital literacy, I recommend every doctor, every healthcare administrator, nurses, like they should be.
Wait, I'm sorry, not digital literacy, data literacy.
Data literacy. Okay. Okay. Data literacy. Well, I mean, let's take a couple steps here with healthcare. I think the most important area to be wise with data literacy today is just like, let's look at security, right? Like how many healthcare systems are going to be held hostage and have to pay ransoms to free up their data? So that's number one. Number two is, how valuable is your data? How valuable is the data of your organization? How do you make that data actually usable? Those are all really important questions. And one of my mistakes with my first startup was we didn't retain all the data that we had captured over the years. So, we're recording doctor-patient conversations and we're finishing their note for them, and we're building really all of the data you need to automate note writing. And for the first little while, we didn't retain all that data. And so we would have been much further along if we had retained all that data and kept it clean. And that's the other thing, anybody who knows data science, like most of the problem in data science is figuring out how do you clean up the data and tag the data and label the data and all those things. Like that, actually, the running the model to build the thing, that's the thing that's pretty automated. Like you just start that. It's getting the data ready to do all that. So I think data literacy, every organization should have a data plan, some sort of data strategy, like what they want to do with their data, how they're going to store their data, how they're going to keep it safe. Are they going to prepare any of their data for modeling? Like that's, especially a large organization, a healthcare organization, they should absolutely have a plan around that.
Yeah, I mean, that begs the question, like, now we're going to get to a point where data literacy standards are naturally just going to have to come higher, because that's essentially what you need to be able to effectively interface yourself with these AI models. Like, if a model is not working the way you want it to, maybe its bias is out of whack, maybe its ethics is out of whack, maybe you as a doctor need to go in and fine tune that. Like you said, it's automated, but you just need to know a little bit of you just need to have a little bit of data literacy to just be able to tune the model yourself, right? On the flip side, they don't teach this in colleges.
Yeah.
So if you have a new application for a new physician, it's like, okay, well, I know you're a smart person, but what's your data literacy level? Big problem. A lot of people are coming out with 0.
Yeah.
So, what are your thoughts around that?
So I agree that people need to spend time on data literacy. And I mean, I'll often tell people like they need to be playing with the newest models and seeing what the weaknesses are and the strengths. And like, you have to stay engaged in this space. And it's moving so quickly. I mean, 6 months from now, what we're playing with today is like going to seem archaic, which is crazy because when GPT 3.5 first came out and everybody's minds were being blown by this new chat GPT. And then like 4 months later, 4 came out and everybody was like, whoa, this is so much smarter. And then Gemini 1.5 Pro. And like, we keep having these smarter and smarter models. We're going to have GPT-5 come out at some later point. Like they're going to get smarter and smarter. So you have to stay up to date with what's going on with the models, number one. Number two, you're only going to be able to make smart decisions and affect decisions if you understand the weaknesses and the strengths of these models. And so people who don't pay attention they're just going to kind of fall along the wayside with being able to be involved in the conversation. And you actually see this in scientific papers today. So you'll see scientific papers where they use GPT 3.5 to test something and they publish the paper, but it's now outdated because GPT-4 and a multi-agent GPT-4 can perform so much better that old paper is already outdated. Who cares if GPT 3.5 failed? GPT-4 succeeds, and GPT-4 with multiple agents succeeds 10x. And so, yeah, you have to really pay attention and know. Otherwise, you're going to seem ignorant when you're talking about, what's happening in AI.
That brings another interesting question to the table. If everybody at a healthcare organization, right, is focusing on healthcare and figuring out what they're supposed to do right now, who is the appropriate person to talk about this stuff? Like, who's the person in control here and I'm just saying, they're not just talking about it because they feel like they need to talk about it, but they're talking about it because they know the problem, they understand the problem, and they understand why this problem is important. Because, I feel like technology is going to keep moving fast.
Yeah.
Technology is not going to slow down. It only brings to question, are people going to be able to adapt to the rapid pace of technological improvement, right? But if there's no person in the room that can really just be like, hey, I know this, I understand it, it's so important, and we need to get on board with this, and we need to drive this forward, right?
Yeah.
It's kind of like almost a change management problem, right? Like almost.
Yeah.
What does a healthcare organization do if they don't have a person to kind of like lead that?
Sorry, Sal, you cut out for a minute. I missed the last part of
What
that question.
what is a person supposed to do if a healthcare organization doesn't have a person to lead that effort?
Yeah, I mean, you hope that it's the chief information officer, the chief medical information officer. You hope the CIO, the CMIO, maybe the CISO. Like you hope that those people are paying attention, coming up with a strategy. But I think you actually see this kind of across business right now. Everybody's kind of freaking out, like because they don't actually know what their strategy is. And so they're kind of searching like, what is the strategy going to be when it pertains to this technology? So I think that's where you have to use trusted sources. So I mean, that's why it's important to have experts like yourself, like your team, that people can come to and they can say, hey, like we need help building out our strategy. We need help understanding this. What are the strengths? What are the weaknesses? And I mean, I think you see major corporations like Microsoft does a great job with this. I think Google's trying to catch up and doing a better job with this. You see that, but not everybody is going to work with major corporations. And so what you need are trusted consultants, you need trusted advisors, you need people you trust that you can pull in that can help you come up with your strategy. What are you going to do? And realize your strategy is going to be outdated in 2 months. And that's why it's like an ongoing engagement. It's not like you do this once. It's not like multi-year planning and you just come up with your multi-year plan and you forget about it. Like you gotta keep looking at this.
Yeah, I mean, it sounds like somebody really needs to take charge soon on this. But what are the top three technological improvements that you believe will have the most impact for you at Bionic Health in 2024?
Okay. So I would say, I'm excited to see how models continue to progress. Multi-agent modeling is super interesting to us as we look at clinical decision support and, how close can we get all of our clinical decision support and documentation to 100% and that physicians need to make less and less changes. You start to get to a point where things are so good that you have to try to insert errors so that you make a physician pay attention, because what you don't want is you get to 98% and the physician stops paying attention because it's so good all the time. And then I think the really interesting things are going to be, these multimodal models, because right now you can pull in pictures, images, PDFs, but I think it's going to get even more interesting in medicine as you're able to pull in radiology imaging and genomic data and really these large. Medicine is the ultimate big data problem because each person can have, gigabytes and terabytes of data just on them. You get your genome, it's 50 gigabytes of just, letters. And so, yeah, it's so much data. So I'm excited to see how these multimodal models, how they continue to build out. And then it's, as a business, how do you figure out, you don't want to just be a wrapper for these large language models. You want to build out real value where your data is important and how you add your data into the system so that it's really valuable.
Wow, what an adventure. My concluding thoughts are that AI has a big role to play in healthcare this year. Implementing AI really well will provide the most impact out of anything. It was such a pleasure having you on the show, Jared. I'm looking forward to having you on for future episodes.